is Dr. Etienne. I'm a thoracic surgeon in Tournon University Hospital in Paris. And I'm a senior staff surgeon in this department. So we do mostly thoracic oncology. We do about more than 300 major lung resection per year, which means that I do about personally 2 or 3 per week. I do as much minimal invasive thoracic surgery as well as conventional approaches like thoracotomy. So for minimal invasive, we do both VATS and RATS surgery. And for major lung resection, we do all type of resection. We do pulmonectomy, lobectomies, bilobectomies, as well as segmentectomies, all depend on the cases, the size of the lesion, the location, and of course, if it is lung cancer or not. The field of thoracic surgery, especially lung resection, has quickly evolved those last couple of years with more and more sublobar resections being done, like segmentectomies. And we're doing this type of complex resection by minimal invasive, which add to the difficulty. So of course it is knowing that the lung anatomy is different from one patient to the other, because there might be anatomical variation either on the artery, the vein, or the bronchus. It's always good to plan ahead the resection and not be surprised to see any different anatomies from one patient to the other. So that's where those 3D reconstruction software come in handy, because they allowed us to pay more attention to the anatomy, because we can see the whole lung in one big image reconstructed, and we can choose to add or remove either the arteries, the vein, and the bronchus, so which make us get a better understanding of a patient's anatomy. So I think I would say it's a big help. It's a big help I've been using for the last couple of years, and definitely I think that it brings a lot of confidence during operation, and it makes us feel more secure toward the resection. My general impression of the software is that it is a very good software, a very complete software, which gave us a lot of liberty, because at the end we do ourselves the reconstruction. It doesn't take long. It takes like about 10 minutes, and the software does it automatically, which is a big help, because we don't have to manually outline each artery, each vein, and each bronchus. So it does it automatically. And I would say the biggest advantage compared to other software is the fact that it can do the reconstruction without any contrast injection. So this is a big advantage, because some of our patients, I would say a lot of our patients, when they get CT scans, they don't necessarily get it with an injection, which means that if we want to do a reconstruction with the other software, we have to give an appointment specifically to the patient to do this CT with injection. But in the case of Infervision, it's not necessary. So this is a big thing, because sometimes in a rush we might forget to do the reconstruction a couple of days before, and we come at the surgery in the morning, we're like, oh, I would like to do a reconstruction, and we can do it with any CT that's been done. So that's one of the main focus which has driven me to use more and more the software compared to others. I think it will be great if we could manually remove or cut each branch or from the vessels or the bronchus, in order for us to really mimic the intervention as it goes. So it might give us a better walk-in into what we might expect during surgery, and it might give us a better understanding. I think that would be the main improvement I would suggest the company to do, but otherwise, yeah, I think it's a good software.